There we go. Okay. So I've washed my hands and cleaned my stethoscope, and I'm just coming to check the patient's medication record just so I have some background information on them. So we have Rita Wilson here, and her date of birth is January 23rd, 1944. She's a 72-year-old female. She has no known allergies, and she has a diagnosis of gastritis or gastroenterovirus. And we have some PRN medications here for her. So she has some Gravel, some Tylenol, and she has morphine as well. And it looks like she was given 2 hours ago she was given the 2 milligrams, or 1.5 milligrams of morphine. Okay, so I'm coming into the room now. Hi, Mrs. Wilson. How are you?
Good, how are you?
I'm good. So my name is Rihanna. I'm going to be your second-year student nurse today. Can you please tell me your full name and your date of birth?
Rita Wilson, January 23rd, 1944.
Okay, perfect. And so I'm just going to do a quick safety check for the room.
Okay.
So I'm going to check your suction here, make sure that it's on, working.
Yeah, luckily they haven't had to use that yet.
Yeah, it's probably a good thing.
Mm-hmm.
Okay, it's working here. So I'll turn this off. And now I'm just checking the oxygen. Make sure that that's working as well. Working there. Okay, and so now I'm going to ensure privacy for the patient. So I'm going to pull these curtains. And I'm also going to check the brakes of the bed, which are on. And I'm going to pull the side rails up. And for this bed, the side rails do not go up, but I would put them up in a real scenario. And okay, so hi, Mrs. Wilson. So I hear you're having some pain today.
I am.
Okay, so I'm going to ask you some questions about your pain.
Okay.
Okay, so what kind of provokes it? So what makes it worse or better, usually?
Movement, like when I'm moving around, it hurts when they're rolling me, stuff like that.
Okay.
It kind of just hurts all the time, though.
Right, okay. And how would you describe the quality of your pain? Like what does it feel like?
It's pretty sharp, and it comes in waves, like stabbing, I'd kind of say. Yeah, it feels like someone's stabbing me in my stomach.
Okay. And does it radiate anywhere? Does it kind of stay in the same place, or?
No, it's pretty much just in my stomach.
Okay. And if you could rate it on a scale of 0 to 10, 0 being no pain at all and 10 being the worst you can imagine, what would you say it is?
Probably like an 8 or a 9.
Oh, okay. That sounds like you're in a lot of pain.
Yeah,
Okay.
yeah, it really hurts.
Right. And what time did it start hurting you? Like when did it start?
It just got bad again.
Okay.
It was like not so bad for a while, but it's just hurt me ever since I came into the hospital. It's hurt, but it definitely hurts more right now than it has before.
Okay. Okay. And so I saw on your medication record that you were being given your last dose of the morphine was 1.5 milligrams, and you said you're still in quite a bit of pain. Did you find it was effective, that dose?
No, I found that, no, it just wasn't really effective. I was still in quite a bit of pain, and now it's just getting worse.
Oh, okay, that's not good.
Yeah.
Okay, so you do have a dose ordered for 1 to 2 milligrams, so maybe we'll try giving you the 2 milligrams. Does that sound good?
Yes, please.
Okay. Do you have any questions or anything all about this medication? Are you familiar with it?
Yeah, I've been taking it on and off for a while now, since I came to the hospital, so I think I'm pretty comfortable with it.
Okay, sounds good.
Thank you, though.
Yeah. And I would also take a set of vitals because it's paying special attention to the respiratory rate because the morphine can be a depressor. Okay, so I'm just going to check the IV site, your IV site before I leave and get that medication for you. So I'm just looking for any redness or swelling, which would indicate phlebitis or infiltration. Do you have any pain at your IV site at all?
No, it hasn't bothered me at all.
Okay. Okay, sounds good. Well, it looks good. So I'll leave you here, and I'll be back in about 5 minutes to go. I'm going to go get your medication for you.
Okay.
Okay. All right. So now I'm here at the med cart, and I'm looking at my IV monograph card. So we have morphine sulfate here, and it says for direct into IV tubing, undiluted into running IV or diluted in at least 4 to 5 milliliters of normal saline. So yeah, we have some normal saline here. and it says a maximum rate of 2 milligrams per minute. And we're going to be giving 2 milligrams, so we're going to do that over a minute. And I'm just checking that the compatibility, it is compatible with the normal saline, so that's good. Here we have all our side effects, so I'm aware of those. Okay, so now I'm just going to check the expiry date of my normal saline before I go, which is good. I'm going to go to the narcotic store and I'm going to get my morphine. And of course I would sign that out as well. And I would also be getting someone to watch me waste mine as well. So, okay, so I have here morphine 10 milligrams per milliliter, and I want 2 milligrams, so I'm going to do my med math. So I put desire, so 2 milligrams over what I have, so 10 milligrams times 1 milliliter, and that means I'm giving 0.2 milliliters. Okay. Alrighty. So now I'm going to start my checks here. So for Rita Wilson, I have morphine 1 to 2 milligrams. I'm giving her 2 milligrams. So I'll be wasting 8 milligrams, giving it to her IV direct every 2 hours, and she was given it 2 hours ago, so we're safe to give her morphine as needed for her pain. So for Rita Wilson, I'm giving her morphine sulfate. I'm giving her 1 to 2 milligrams. I'm going to give her 2 milligrams because her pain was an 8. I'm giving it to her IV direct every 2 hours for her pain. So I'm just going to get all that out of there. And I'm going to get my 10 milliliter syringe. I'm using a 10 milliliter syringe because I'm going to draw up 9 milliliters of normal saline, and then I'm going to drop the full milliliter of the morphine. So that way I have a 1-to-1 ratio, and I know that every milliliter I have 1 milligram of medication. So I will be giving her 2 milliliters. Yeah. So I'm going to break open my ampule here. And I'm going to break it away from me. There we go. This is going to go into the sharps. Now I'm going to attach my blunt, or I'm going to actually, yeah, I'm going to put this on here, my blunt fill without the filter. And I'm going to, I want to drop the normal saline first. So I'm just going to swab the top here for 15 to 30 seconds. And yeah, making sure expiry date is good. It's good. Okay. 15 to 30 seconds. So now that I have my blunt filter needle, or no, non-filter, because I'm not using an ampoule yet. No glass. So I'm going to want to inject air into the normal saline vial. Now I'm going to withdraw 9 milliliters. Just wanting to make sure that all the air bubbles are out. Okay. Just need a little bit more here. Okay, so now I have 9 milliliters here of the normal saline. going to recap this. I'm going to take off my filter needle, or non-filter needle, and put this in here. And now I'm going to attach my filter needle for the morphine. Okay. So now I'm drawing up to 10 milliliters because I want the full 1 milliliters in here of morphine. Okay, I'm just getting rid of my air bubbles here. Okay, so now we have 10 milliliters of total here. Okay, I'm going to recap this here, and I can get rid of my morphine. Oh no, not yet. Blunt filter. Now I'm going to do my last medication check. I'm going to first put on a dead ender to maintain sterility. Okay, so I have that here now. So I'm going to do my last check. So Rita Wilson, I have morphine sulfate, 1 to 2 milligrams. I'm giving her 2 milligrams, which is diluted with 9 milliliters of normal saline to have 1 milliliters per 1 milligram. I'm giving it to her IV direct every 2 hours as needed for her pain. And I am dotting here as well. And now that I have everything in here, I can put this in the sharps container. Okay, and I've dotted. I'm good to go. This is all garbage. Okay, so now I'm gonna go to save a day. Save a day, so I can bring all my supplies with me. Okay, so here I have my flush, my saline flush, and I have my medication here, my morphine, and I have another dead ender, and I have some gloves, and I have some alcohol swabs. Here. And I'm going to bring my MAR into the patient's room. And I've washed my hands and cleaned my stuff. So, okay. Hi, Mrs. Wilson. I'm back with your morphine.
Oh, thank goodness.
Yes, I know. Okay, so I'm going to pre-step wipe this table here. Now I can put my supplies down. And okay, so I'm just going to double check your wristband here. And can I get you to tell me your full name and your date of birth again?
Rita Wilson, January 23rd, 1944.
Perfect. Okay. Awesome. So first thing I'm going to want to do, I'm going to put on my gloves. I'm going to raise the bed to a more comfortable height for me here. So we're about waist height. Okay. So I'm just looking at the IV site. Okay, so now I'm going to want to flush the IV site first to make sure that it is patent. Okay, and so I'm going to sanitize the Y port here for 15 to 30 seconds. Okay. Okay, and I'm going to leave this underneath so I know which port I sanitized.
Here, I can move my arm a little bit.
Thank you, that really helps. Perfect. Okay, so now I'm getting my flush here. off this tip here, and I'm going to connect it to the Y port. So now I'm going to want to flush the IV site with about 2 to 3 mils, and I'm going to do that in a pulsing motion. I'm going to want to make sure that I'm unclamped here, which I am unclamped now. Okay, so pulse, pulse, or we can just make it 2. Pulse. Alright, so there we go. 2 to 3, put 3 mils there. I'm going to take this off, and I'm going to put another dead ender on, just so I can reuse it for the rest of this procedure. Put this in here. Okay, so now I have my morphine, and we know that I'm going to be giving 2 milliliters of this because I want to give 2 milligrams, and each milliliter has a milligram, so I'm going to give 2 milliliters. And I'm going to want to give this, it's 2 milligrams per minute, so I'm going to want to give 2 milliliters over 1 minute. I'm going to re-sanitize this port again. 15 seconds. Okay. Take this off here and connect it. Okay. So now I have my clock here, so I'm just washing this here, and I'm going to be giving half a milliliter every 15 seconds. Because that will equal to 2 milliliters over a minute. So, just watching here. Over 15 seconds. Okay, so that's half a milliliter. Okay, so now I'm going to give the other half a milliliter to go to 9 milliliters, 1 milliliter. Okay, so I've given half of the dose right now, given 1 milliliter, and it's been 30 seconds. Okay, so now another half a milliliter for 15 seconds. Alright. And we have 1/2 a milliliter left to give. Okay, so 1 more half a milliliter, and this will be my final of my 2 milliliters. Okay. Perfect. And how does that feel? Do you feel okay?
Yeah, I feel fine.
Mrs. Wilson? Yeah?
Yeah.
Okay. Perfect. So now that I'm done with that there, I'm going to recap this, and I'm going to be wasting this into an appropriate wasting bin. And okay, so now that I've done that, I'm going to want to flush again. So I'm going to want to put the same amount that I just put through, 2 milliliters of normal saline over the same 1 minute. Just going to re-sanitize port. Okay. And this is just to ensure that the medication is properly administered at the right rate. So I'm going to give another half a milliliter over 15 seconds. Okay, and another another half a milliliter over 15 seconds. And another half a milliliter. And then another half a milliliter over 15 seconds for a total of 2 milliliters over a minute of normal saline. And now that I've done that, I can finish the rest of my flush. I have about 3 milliliters left, so I'm just going to do the same pulsing action to ensure that all the medication is into the bloodstream. And how are you feeling okay, Mrs. Wilson?
Yeah, I'm already starting to feel a little bit better.
Perfect, okay. All right, so we're all finished. We're all finished there. Okay. I'll get all this stuff out of the way for you. Okay. So, do you have any other questions for me, Mrs. Wilson at all?
No,
Okay.
I don't think so. I've taken it before, so I just hope it kicks in and that my pain goes away.
I hope so too. So I'm going to be back in about 15 minutes to reassess your pain and everything.
Okay.
And I'm going to take another set of vitals and just to ensure that I'm watching your respiratory rate and we're not having an adverse reaction to that. Okay. So I'm going to relower. I'm going to take off my gloves now. I'm going to lower the bed again.
Beds sure are slow.
I know. It's a hassle. Okay, so I'm just ensuring that the bed brakes are still on, the side rails are still up, and I'm going to be getting all my supplies out of the room, and I'll be back in about 15 minutes for you, okay?
Thank you.
Okay, thank you. And I've also washed my hands and sanitized as I come back. And all this would go into the sharps, and then my morphine would go into an appropriate waste bin, and I'd have someone watch me waste it. And now I am just going to document what I gave. So I gave here IV, I gave 2 milligrams at 0800, and I gave, and my initials are RW and BSN2. All right, and that's it.